This is a South African business channel where we look at the top companies in South Africa. Let's start with Netcare. Netcare Limited is a South African private healthcare company. It operates through a number of subsidiaries and employs just over 21,000 people. The group offers a range of medical services across the healthcare spectrum and operates South Africa's largest network of private acute care hospitals, as well as emergency medical services, primary healthcare, renal dialysis, and mental health services. Netcare provides the following private healthcare facilities and services. Acute care private hospital services available at 51 owned and managed Netcare hospitals, including 2 public-private partnership hospitals with a total of over 10,000 beds. 3 of its hospitals have been accredited as Level 1 trauma centres by the Trauma Society of South Africa and are the only Level 1 trauma centres in the private healthcare sector in South Africa. Radiosurgery, radiotherapy, chemotherapy through Netcare Cancer Care at 9 dedicated centres, as well as haematology and bone marrow transplants at 5 centres, paediatric oncology at 3 facilities, and robotic-assisted surgery for cancer at 3 hospitals. Primary healthcare services provided through Netcare Medicross at 77 medical and dental centres countrywide. Day surgery performed at 15 day hospitals located either within Netcare Medicross centres or functioning as freestanding facilities. Pre-hospital emergency medical services provided through Netcare 911 by emergency care practitioners. Netcare 911's fleet of emergency vehicles includes road ambulances as well as helicopter and fixed-wing air ambulances, dedicated mobile intensive care units and rescue vehicles. Occupational health and employee wellness services provided through Netcare Occupational Health, contracting with employers ranging from multinational corporates to smaller enterprises across all industry sectors. Mental health and psychiatric services provided through Netcare Akiso at 12 dedicated facilities. Affordable private healthcare products offered through Netcare Plus and aimed primarily at individuals and families without medical cover. Chronic renal dialysis services offered through National Renal Care at 79 dedicated renal dialysis units countrywide. Netcare is also a private trainer of nursing and emergency medical personnel through Netcare Education's Faculty of Nursing and Ancillary Healthcare and Faculty of Emergency and Critical Care. The Faculty of Nursing and Ancillary Healthcare provides education and training at 5 campuses and the Faculty of Emergency and Critical Care at 2 campuses. Netcare embarked on a digitisation program in 2018. Netcare is implementing an integrated, fully mobile patient care system, CareOn, as a key part of its digitisation project. History. Group history 1996. Listed on the JSE Limited, South Africa, with 6 owned and managed hospitals. Netcare was incorporated in South Africa on 28 June 1996 under the name Ablab Designs Proprietary Limited. It changed its name to Network Healthcare Holdings Proprietary Limited on 8 November 1996 and converted into a public company on the same date. Netcare was initially formed to combine the business operations of certain related companies, the management interests of Clinrun, a specialist hospital promotion and management corporation, and the hospital interests of Dr. Jack Shevel, Netcare's founder. Who is Dr. Jack Shevel? Jack Shevel is a primary care physician turned entrepreneur and now runs the Shevel Family Office LLC in San Diego. He was the founder and CEO of Netcare, the largest integrated healthcare company outside the United States. Under his tenure, Netcare delivered a compound annual growth rate of 30% for 10 consecutive years and owned and managed 112 hospitals with approximately 12,000 full-service acute care beds supported by 14,000 dedicated staff. Jack is currently Chair Emeritus of a Toronto-based company which provides multi-dose packaging to 96,000 residents in 1,400 senior housing communities across Canada. Corporate social responsibility and the welfare of healthcare workers have always attracted his attention. His greatest personal achievement was working with President Nelson Mandela to form the Walter Sisulu Pediatric Cardiac Center for Africa, which saved over 400 children that needed surgery for congenital heart disease. Netcare received a commendation in the House of Commons from Tony Blair for their ISTC innovation in the NHS. He has served on committees with the Gates Foundation, World Bank and IFC to improve people's lives and health in Africa. The US granted him O1 visa status for outstanding work when his soulmate and 4 children emigrated in 2006. Jack is working with his children, Daniela and Sean, on this legacy project. The Shevel family office will be the sponsor and will invest €1 million, 40%, with other investors into the Portuguese REICIGSA. In his free time, Jack loves to play golf, watch sports and spend time with his family. Now back to our timeline, 1997. Netcare acquired Clinic Holdings, 25 hospitals. Netcare negotiated and successfully concluded an agreement for the acquisition of a controlling interest in clinics from Mr. Barney Hurwitz et al. On 21st July 1997. In addition, Netcare simultaneously acquired 8 hospitals privately owned by Mr. Hurwitz, Clinford, the Durban Oncology Centre, Canker, as well as control of Linksfield Park Clinic, Linksfield. 1998 acquired Excel Medical Holdings, 10 hospitals. Acquired control of St. Anne's Hospital in Pietermaritzburg and Pretoria Oos Hospital. Invested in the Ampath Trust, launched Netcare 911, 1999. Launched SAIA Netcare Travel Clinics. Netcare Travel Clinics is part of Medicross, which in turn is a fully owned subsidiary of Netcare Limited. Experienced and caring healthcare professionals at our dedicated Netcare Travel Clinics and select Medicross family medical and dental centres across the country. 2000 expanded Storks Nest clinics which provide antenatal care. 2001 acquired Medicross Healthcare Group. The Medicross primary healthcare brand is a household name across South Africa, comprising nationwide, multidisciplinary primary care and dental centres complemented in selected cases by pharmacies and day theatres. Invested in Community Hospital Group, acquired the Umhlanga Hospital, established Netcare UK 2002, concluded PPP with Free State Department of Health in Bloemfontein, acquired the Margate Private Hospital, opened the Queels Riviera Hospital in Cape Town. A joint investment and development initiative between Community Hospital Group and Netcare. Netcare UK awarded NHS tender to perform cataract operations. After due diligence studies and in-depth assessments of several business opportunities, a strategy of partnering with the NHS, the largest provider and purchaser of healthcare in the UK, was implemented. In addition, Netcare implemented several waiting list initiatives to gain experience in the UK market and to better understand the workings of the NHS. In Kent, Merseyside, Cumbria, Lancashire, Hampshire and Thames Valley, to carry out 44,500 cataract removals over a 5-year period, and the £2.5 billion contract for the Greater Manchester Surgical Centre, a 48-bed facility at Trafford General Hospital to provide 44,863 elective procedures over 5 years with a diagnostics programme valued at £1 billion, 2003. Launched the Walter Sisulu Paediatric Cardiac Centre for Africa at Sunninghill Hospital. Launched NetPartner. In July 2003, Netcare spearheaded an initiative to form South Africa's first multidisciplinary managed care provider network, NetPartner Investments Limited. The network was supported by more than 6,000 participating doctors, specialists and dentists across the country. By leveraging economies of scale, NetPartner would offer medical schemes innovative managed care products to their existing members and to uninsured markets, giving more South Africans access to affordable quality healthcare. The business would also invest in healthcare enterprises, including the development and management of the NetPartner Managed Care Network. 2004, it signed a contract to carry out 41,600 cataract operations for the NHS at sites throughout the UK, including Cumberland Infirmary. 2005, launched the Health Partners for Life B deal, achieving direct black ownership of more than 24%. Netcare UK opened Greater Manchester Surgical Centre as part of the Independent Sector Treatment Centre programme. 2006, acquired Prime Cure, unwound cross-shareholding in NetPartner. Acquired controlling interest in General Healthcare Group in the UK, 49 hospitals. Acquired a controlling stake in General Healthcare Group, the UK's largest private hospital group with 50 hospitals, in 2006 for £2.2 billion. This brought Netcare's total number of hospitals to 120 with over 11,000 beds, 510 operating theatres and 37 pharmacies. General Healthcare Group had a subsidiary company, Amicus Health, which tendered for NHS contracts. It had contracts with Stracathro Hospital for 8,000 episodes of elective surgery in orthopedics, urology, general surgery, and gastroenterology from 2006 to 2009. The company used Vanguard Healthcare mobile units to treat NHS cataract patients across the UK. The mobile cataract units in Cumbria had failure rates 6 times that of local NHS facilities. 2007, awarded PPP concession agreement for Port Alfred and Settlers Hospitals in the Eastern Cape. Opened Albalito and Blauberg Hospitals in South Africa. Opened 3 new NHS facilities in the UK. 2008, acquired the remaining 56.3% in Community Hospital Group, 5 hospitals. Acquired Linkwood Clinic. General Healthcare Group acquired 7 Nuffield hospitals, the Oxford Clinic and the Woodlands Hospital in the UK. Appointed as preferred bidder for public-private partnership with the government of Lesotho. The 2012 scandal, Health Mech Sibongiseni Dlomo and Health Minister Aaron Motsoaledi said he will only hold talks on whether further action should be taken against healthcare giant Netcare after the Durban High Court makes a ruling on some of the doctors accused in the kidney transplant scandal. A year after he had said he would schedule a meeting with Motsoaledi to address the transplant racket, Dlomo said on Monday he had decided it would be preemptive to schedule the meeting while the court case was pending. Dlomo said a decision on what action, if any, should be taken against Netcare or the doctors in the rest of the country would only be taken once the court case was completed and the Health Professions Council of SA's investigation was finalised. Only then will I meet the minister to see if further action needs to be taken, he said. He added that he would not rule out the possibility of the department revoking Netcare's license over its role in the illegal transplants. Dlomo's comments come as the 6 health professionals alleged to be involved in a multi-million rand kidney donor scandal wait for the state's response to their application at the Durban High Court to have the charges against them quashed. The health professionals cited delays by the state for the matter to come to trial as the reason why the charges should be dismissed. Professors John Robbs and Arif Hafaji and Doctors Neil Christopher and Mehadev Naidu, along with former St Augustine's Hospital Transplant Unit staff Lindy Dixon and Melanie Azor, who are now doctors, face charges of fraud, forgery, assault with intent to do grievous bodily harm, and contravening the Human Tissues Act. It is alleged that 109 illegal kidney donor operations took place at St Augustine's Hospital's transplant clinic from June 2001 to November 2003. The international scheme was revealed when 11 Brazilian donors and 2 alleged runners were arrested in Durban in 2003. The state alleges that the transplant laws were contravened because both donors and recipients made false assertions that they were related and because donors were paid for their kidneys. The 4 surgeons, however, still maintain their innocence and say they were also victims of the scam. In 2010, Netcare KwaZulu-Natal pleaded guilty and paid a 4 million rand fine and agreed to a 3.8 million rand confiscation order. In the same year, former nephrologist Jeff Kohlmeyer, now living in Canada, admitted to 90 counts of contravening the act and paid a 150,000 rand admission of guilt fine. Hebrew interpreter Samuel Ziegler paid a fine of 50,000 rand and was given a suspended sentence of 5 years for his role in the deals. We are aware that Netcare apologized and paid the fine, but we don't know yet if that is enough, Dlomo said on Monday. On whether the department would revoke Netcare's license, Dlomo said, "You can't just revoke the whole group's license. We first need to find out at which of their hospitals these alleged illegal operations took place. That is why we are waiting for the court proceedings and the HPCSA investigation, because they will guide us on what action needs to be taken based on the ruling and the findings." Daily News. In 2019, Netcare partnered with Founders Factory Africa, selecting 35 African health tech startups for an acceleration and incubation program. Accelerated startups will receive a £30,000 cash investment and £220,000 in support services from Founders Factory Africa. Incubator Health Tech Ventures will receive £60,000 cash and £100,000 towards support. Founders Factory Africa and Netcare will share a 5 to 10% equity stake in each startup accepted into the program. That concludes our overview of Netcare Limited, a leading private healthcare company in South Africa. Stay tuned for more insights into top companies in South Africa on our channel.